Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Well, did you make a New Year's resolution to lose weight? We've got the experts here to help you. Radiation oncology, how that is used in treating cancer. And we're going to answer the top Googled questions of healthcare. Also, the Friends of the Library are here. But tonight we're going to start off with Dr. Paige Quintero and Dr. Weiss, who are bariatric surgeons with Baptist Health. And you're going to help us lose some weight, I hope.
Yes.
Now, Dr. Quintero, tell us a little bit. You recently got I'm going to call it a weight loss center of excellence.
Yes.
Tell me about that.
So we are very proud. We are the first bariatric medical weight loss center of excellence in the state of Kentucky, and we also just received renewal of our surgery center of excellence. And so we have both of those things now, and I think that is a huge step towards making a comprehensive center for patients. We want to be there to support patients through surgery, before surgery, after surgery, and even those people who aren't going to have surgery, we can support them with medical weight loss.
Now, you talked about medical weight loss, so we're going to come back to that, but you guys are surgeons, and Dr. Weiss, you do bariatric surgery, so tell me a little bit about what that is and what procedures you do.
Sure. Bariatric surgery, also known as weight loss surgery, and there's a variety of procedures, and we offer several depending, to fit the individual's needs. I would say the most common procedure we do is called the gastric sleeve, and we do that laparoscopically or robotically. Everything we offer is minimally invasive. There's also procedures like the gastric bypass and then a modified duodenal switch or formal duodenal switch. We've gotten away from the lap bands. That was kind of the last decade, and they just didn't pan out like we thought they would, so we don't offer that.
Well, who's a candidate for surgery?
Well, it goes by generally insurance, and they base it on body mass index, also known as BMI. And generally your BMI has to be 35 or higher. And you can go on Google and say BMI calculator, and you put in your height and your weight, and it'll tell you what your BMI is.
And these procedures are done as an outpatient, or do you have to spend time in the hospital?
Usually all of our procedures you spend overnight.
All right. Now, he mentioned BMI. So are there things you can do before you get to surgery?
So a lot of insurances actually require a waiting period. Now, this is decreasing year by year, but what we like to see patients do while they're waiting for surgery is be educated about what's a healthy diet, and in a word, protein, high protein. Be educated about adding more activity in their lives, exercising, and just preparing for the journey they're about to make after surgery.
All right. Now, after surgery, what kind of results you see, Dr. Weiss?
Well, the most common procedure we offer is a sleeve gastrectomy. Small incisions, takes about an hour, you go home the next day. And usually we see about 70% of excess body weight loss over the next 9 to 12 months. Typically, for an average BMI person, about 70 pounds at 3 months, and usually around 100 pounds at 6 months. So it's a very rapid weight loss.
So what do you see? Diabetes goes away?
We've seen that over and over for a long time, and we can't explain it because a lot of times the diabetes will get better or go away before you leave the hospital. You might leave the hospital off insulin. So we haven't quite explained why the surgery leads to those kind of changes before you even see weight loss. But the health benefits are tremendous, and that's why insurance covers it.
Real quickly, Dr. Quintero, there are some medicines now that we've seen a lot of them on TV. Are they helpful?
Oh, yes. So this is the problem with being on a diet. People get hungry, and we have cravings. I say we. I'm a bariatric surgery patient too, so I understand this. It's hard to stay on a diet because your body is fighting against you. What we do with surgery and also with medicines, and surgery probably a little more powerful tool, but medicines too, is we decrease hunger and we decrease cravings. There's a newer class of drug called the GLP-1s, and then an even newer class of drug, the GLP-1 and GIP combo, Mount Jaro, and the GLP-1s are Ozempic, Saxenda, Wegovy, and these have been revolutionary because they are so efficient at decreasing hunger and modifying the GI hormones. We also have other drugs used as well. We've got Topamax, good old phentermine, we've got lots of things. But the goal with these drugs is to take the edge off so that you can stick with a good diet and have results.
Well, that's great information. We appreciate you all coming in. Thank you so much. And if you're having trouble losing weight, Baptist Healthcare Weight Loss Center of Excellence can help. We'll be right back.